requests from others that couldn't attend. So we will be recording this session so that others can listen and get this later.
Okay. I think I might just go ahead and start because we had anticipated a smaller crowd for this call, and I wanted to be able to do some introductions so we know who's on the call. So as people join, they will pick up on the fact that we're doing some introductions. So I will just go ahead and get us started. So like Lori mentioned, my name is Caitlin Emmerich. I work at Linn County Public Health, and I'm here to help facilitate this call because I was part of a conversation that happened between myself and Danielle Majeski. Danielle maybe is on the call, I'm not sure. Maybe she'll write a note to us if she is. And Lori, and I believe that the conversation between the three of us initially started at a University of Iowa College of Public Health Alumni Council meeting, and Lori, correct me if I'm wrong, but because Lori had posed the question, you know, what are things facing the public health workforce that we could be helping out with in providing additional training or something to better help prepare our public health workforce. And Danielle and I both had mental health as an issue on our local community health improvement plans and said, you know, we really need to do work in this area. And from then we pulled in Joy Harris with Iowa Department of Public Health and had a couple more conversations about, you know, what do we know that's out there and what can we do to engage our other local public health partners. And it kind of turned into this idea to have a call that is an open invitation to other Iowa public health professionals to just share information about what we're doing and what our needs are and what's working well, what we might be able to do in the future. So that's kind of the welcome and the background together. I sort of skipped ahead to that. But I introduced myself, and I think it's really important for us to know who else is on the call. So Lori, is there a way for us to unmute participants so they can share? I see Danielle is here, and she maybe tried to talk, and we couldn't hear her. So could we unmute people for this part?
Yeah, I think.
Good morning, Caitlin. Good morning, everyone.
Danielle, do you want to be the first one to introduce yourself since you're here?
Well, wonderful, I will. So hello, my name is Danielle Majeski. I am the director for Washington County Public Health, and like Caitlin said, we did have this conversation during a College of Public Health Alumni Advisory Board, and so considering how many people had this as part of their Train the Hip, we're really excited to have everybody discussing this together.
Maybe we could quickly run through other people that are on the call. So if we have a moment in silence, please take that as an opportunity to just introduce yourself and maybe and the organization that you're with.
This is Jodine Duvall. I'm the administrator in Warren County Public Health.
This is Angela Cruz-Visser, and I'm a community health planner at Community Health Partners of Sioux County.
Good afternoon.
Green County Public Health.
Dave Coach, Johnson County Public Health.
Tiffany Jepkes and Brooke Barnes from the Scott County Health Department.
Hi, everyone. This is Melissa Scher, a neighbor to Tiffany and Brooke at St. Ambrose University Public Health Program.
Good afternoon. This is Christy Roby Williams from Trinity Muscatine Public Health Department.
Delma Harden with Delaware County Public Health and Charity Lockey with Delaware County Public Health.
This is Pam Bogue from Buena Vista County Public Health. I'm administrator here.
Zombie with the Iowa Department of Public Health.
This is Burdette Davis with the Iowa Department of Public Health.
Joy Harris, Iowa Department of Public Health. Abigail Tihak, Dallas County Health Department.
Erin Barkema, Iowa Department of Public Health.
This is Deanne Decker from the Iowa Department of Public Health.
Is that everyone?
If not.
All right, well, given the silence, I'm going to keep us moving along. My partners at the Midwest Public Controls of the screen, did you guys just see the screen move to the agenda page?
Yep, we did. You're good to go.
Okay, good. Now I know that I'm doing it correctly. Great. Thank you for bearing with me for that. So the small group of us that got together, Joy, Danielle, Hannah, Lori, and myself, decided in the 1 hour that we have that we thought that we might be able to cover some of these items. So we kind of have given a chance to introduce ourselves and a background of kind of how we got to having this conversation. Another thing that happened is that the University of Iowa put together a survey that was distributed to local public health partners through the regional public health consultants at the Iowa Department of Public Health. And so we do have the results of that survey that Casey will share. We'll have a chance to talk about the identified needs related to mental health in our communities, and then how we are addressing those needs successfully, whether it's just something that we know is working well in our community, or if we have implemented best practices that we know that are working. And then having the opportunity to talk about, of those things that are working well, what could we be reproducing? And this kind of goes back to the background of the formation of just this exploratory call. Is we recognize as a very small exploratory group that there currently is not a good way for us to share information across our county lines or jurisdictional lines, whatever that looks like for you, with other people in a way that's either available to lots of people. So if there is a system that exists like that right now, we did not know what that system was, or maybe there isn't a system for us to share information. So we wanted to be able to share, and so we built that piece into this conversation as well about what we could be reproducing that's really going well in communities, and how we can try to start maybe doing some of that work. And then before we end the call, we want to talk about next steps. Something that came out as an option. An option for a next step is a possible learning community. We can explore that, or we can just explore other options that maybe come up in our conversation. So I believe I've given the background kind of in my introduction of myself and in Danielle's introduction. If Joy wants to add anything additional, I will certainly let her do that. But like I said, this is just an exploratory conversation to really talk about the public health professionals and how we're doing work related to mental health in our communities, given that we know that mental health is on so many of our local community health improvement plans, and also in our state, the Healthy Iowans plan. So I think we have an opportunity now to hear from Casey to share some of the survey results from the survey that was distributed to public health professionals around mental health in their communities.
Okay, great, thank you. Again, my name is Casey. I'm a master's student here at the Iowa College of Public Health. So go ahead and get started. Maybe. Okay, so like Caitlin said, we sent this survey out, and we had 9 people respond. Approximately half were rural and half were non-rural, so hopefully this gives us a little bit more generalizability to what we have found. All of our respondents indicated that mental health, either all the related issues, access, or both, were part of their China HIP. And this just demonstrates a commonality across all counties in Iowa. We were looking at collaboration. We noticed that everyone also indicated that they are working in collaboration with some sort of entity to address their mental health in their county. Mostly they're working with community level mental health providers and coalitions or other organized groups. Something else we noticed is that there's discrepancies in some of the responses that indicated there may be some miscommunication within departments about what resources are actually available and which ones are being utilized. And then we found some common barriers within the responses. So the recognition of gaps within the system, but not really knowing how to address them. And this could be related to a problem of resources, whether that be monetary, workforce, time, resources, or even expertise. And then we wanted to address coordination, which we found was the most common strategy to addressing these barriers, but also looking at partnerships, involvement, and advocacy for mental health. And these were kind of just the biggest areas that we found people were having best practices with. So it's just a very brief overview of some of the results. I didn't want to read it verbatim for you, but that's what I have.
And we can share these slides with you all after the webinar, so don't think you need to jot it all down right now. We'll share it with you.
Yep.
Are there any questions for Casey with the survey results? Do we unmute? Oh, just 1 second, we'll unmute you if you have questions.
All right, I unmuted everyone.
Okay.
So if you have questions, you can speak now. All right, I'm going to remute everyone. If you do have a question, you can put it in the chat box and we will get to it.
Anything, Caitlin, that you want to?
No, I think we could move on to our identified needs conversation. I think that probably some of these were shared in the survey, but it might just be more comfortable to have a conversation about it. So we know that mental health is in many people's community health improvement plan, and we know that this is a complex issue to solve as a community. And so the other consideration is that the needs of our communities could be very similar, or they could be very difficult or different, excuse me. So I think we just wanted to have a conversation and dive a little deeper into what those identified needs related to addressing mental health in different communities might be. Is there someone that would like to start off the conversation around that? Or would it be helpful if I gave an example? Or maybe people are still muted. Let's check that.
Where do you want me to talk?
Just a minute.
Yep. Hannah's just unmuting people.
Okay.
You're all unmuted. I'm sorry. I'll just stop remuting you all.
Thanks, Hannah.
Just be aware you're not on mute, so don't do anything embarrassing.
Proposed objectives. And just throwing ideas out there.
This is Delaware County.
Any specific targets that they have in terms of numbers or training? I think the more specific we can be, like how many people will be trained? Okay.
I think we have a conversation happening in the background here. I was trying to decide if that was a comment or a conversation. Thelma, did I hear you trying to speak?
Yes. One of the challenges we have is just providers, the lack of providers, especially not just in the psychiatric, but in behavioral health. The other thing that I know that when we work with our China, with the hospital, emergency often identifies the comorbidity problem of drugs and mental health. And the challenges they have keeping straight what agency does what. You know, phone numbers change, grant dollars change, so it seems like they'll have it all figured out for 1 year, and the next year now somebody else has those money and they're providing the services. Or the services don't exist anymore. So it would be nice to be able to have something that I don't know, like a resource that was updated routinely by somebody. I don't know who that somebody is, but sometimes it feels like the resources are updated by happen chance. You know, you happen to go to a meeting and you hear that this agency now has changed their number or there's new contact, and versus you just get the information that you can disseminate.
Okay.
This is Ann Cochran. This is Ann Cochran, and I work for Dallas County Health. My position is a health navigator. I agree that one of the big problems is the lack of providers. Now, part of our health navigation program is that we do have a great resource list, and we provide lists of resources for folks. One of the problems we see is that the providers are not taking on new clients. And another problem that I encounter is there's this firewall between the medical doctors and the behavioral health. I just had a conversation yesterday with a primary care clinic, and I said, could you please help refer this client I'm working with to a psychiatrist for evaluation? And their reply was, well, we don't do that. That's behavioral health.
Okay. What other needs or barriers are communities facing related to mental health?
I think that this is Danielle. So one of the barriers that we face is, you know, like she had just mentioned, you know, lack of providers. But also when we meet, and one of the things that we talked about a lot when we first started meeting was where do we start, because we knew that ACEs, so adverse childhood experiences in children, were impacting long-term outcomes for them throughout their lives, whether it be in actually mental health or health conditions, quality of health. But we were trying to find the balance between, are we proactive and try to do some prevention, when, you know, my sheriff and the law enforcement that sat on the committee are saying, we have a crisis, we are dealing with people in crisis, and trying to find how do we target our efforts, how do we target the minimal resources that we have in terms of providers. Is it focused on screening kids and getting them into somebody, or is it more focused on dealing with those who are in crisis, who are filling up our jails? So that's been a struggle that we've been facing.
Yes, this is Rhonda with Dallas County. And I too, we've had a similar conversation with our sheriff's office here locally. And they say, you know, they feel like they're running, you know, a mental health facility at their jail. And so recently I had the opportunity to set in on a hearing with a gentleman that had been in prison twice with mental health and / drug issues. And so he was looking to going back a third time, and I had to kind of thank the judge, because the judge says, obviously we've had you in prison twice, you're still back in here with the same issues. This time you're not going to prison, you're going to go to a mental health and a substance abuse treatment facility, which I thought was great.
it sounds like we have themes around lack of providers or providers not accepting new patients. We have law enforcement that are receiving a lot of the burden of mental health challenges for the community. And we have a kind of question mark around where in the continuum of life do you start? Do you start with childhood, or do you start with the people that are in crisis, or where do you start when there are only certain resources to go around? Are there any other themes that people see?
Yeah, this is Christy from Muscatine County Area Public Health. And one of the things, we just recently did our needs assessment and health improvement plan, and we do ours in collaboration with the hospital for a 3-year time frame. And it was, our top 2 priorities were substance use/abuse, and the other was access to mental health services. It was identified that in our county, do have a lot of different mental health service providers, from behavioral health intervention services to counseling. Prescribers is always another issue, but we have built that. It just needs to continue to grow. The biggest is we don't have a complex process for the residents of Muscatine County when they are in need of mental health services. From all ages, all spectrums of mental health service need. So from a very benign situational depression, your neighbor has it, they don't know where to go or how to access that care, to a chronic mental health diagnosis or co-occurring. So especially when people are in crisis, because they don't realize what services are out there until they're in crisis and in need of it. So that's where we are right now, in doing a root cause analysis on that identified need of access to mental health, is that people just aren't even aware, and we don't have a process in place for them to navigate that care.
This is Rhonda again with Dallas County, and I think the one thing we find out here in Dallas County, particularly with our health navigation program, that typically when we do get a phone call from someone, the crisis is here. You know, today's the crisis. You know, unfortunately, we need to figure out a way that we can get, or someone can get involved before, you know, they crash.
Okay. So one perspective from Lynn County that I want to share that I haven't heard someone say yet is that we still have an issue with awareness and stigma. And we have all, you know, we have most, or if not all, of the other kind of themes that have come up as well, but we also have people that are uncomfortable talking about their mental health. They're fine talking about their physical health, but their mental health they're not fine talking about. And so then it gets to crisis without anyone knowing what to do because they don't want to talk about it. So that's also something that we're seeing happen. Anyone else want to share kind of needs that they have in their community, or have we covered them all?
One thing I will say is that because you were talking about, you know, people don't know who the resources are and where the resources are until they're in crisis. One of the things that we found out was that before we came together as a coalition, most of us as providers weren't even aware of all of the services that our fellow providers had available to them. And so one of the things that we did was we put together basically a document that we could put out into the community, and also a document that would be laminated just for providers so that they could do a referral system. But we put out a pamphlet, like in hairstyling salons and bars, at the library. I mean, we put it everywhere where there would be no stigma, so that, you know, where there would be a lot of other pamphlets available so that people could offer them, or people could take them with a one of those codes where you can snap it and it'll take you to a website for additional resources. So that was one of the things that I think was most surprising to us, was how many providers didn't realize what our resources were, and if we didn't know, how much more confusing it would be for the general person dealing with a very stressful situation would have in trying to access help.
Danielle, this is Christy, and that is definitely a route that we're looking at, is easy access to resources for all populations, whether it be a service provider, healthcare, human services, for the general public. We currently have something called lmcresources.org. You guys can check it out, but it's quite antiquated. We need an easier app, you know, in order to access and for people to navigate.
So I'm hearing the conversation start to shift to some things that are being implemented in the communities that might be best practices. So maybe let's just talk about those.
Hey, Caitlin?
Oh, yeah, I'm sorry.
I'm sorry, Caitlin. I was waiting for an opportunity to jump in here. This is Dave, Johnson County Public Health. One of the needs that we have down here that I've really kind of observed in the years I've been down here is just the framing of mental health and the approach taken, you know, from an individual perspective, and really public health is never thought of as an organization that could be a partner in the mental health treatment. And certainly, you know, that's something that we're trying to shift the focus from an individual to a population level, so that mental health can be perceived more as a matter of interest for everybody, and that there's so many things that public health, or so many roles that public health can play on the prevention side, rather than just looking at a lack of providers or other barriers and challenges that we all face. So I don't know if that's unique here in Johnson County with the university that we have here locally, or if other people are experiencing that same type of framework that we are here.
Thank you, and sorry, Dave, I didn't mean to cut off the conversation before it was ready. I think that I've also seen that as well in Lynn County, and maybe others have. Any other comments around either what Dave is saying around framing mental health as a public health issue, or other needs of your community that you want to share? Okay. Well, maybe now I won't cut anyone off, and we can start to talk about some of those best practices, because I think a couple of them have kind of come up. So it'd be a good opportunity to flush that out a little more. So it sounds like there's some good things happening around making resources available to people. And did I hear someone say something about an app?
Yeah, this is Christy, and I think that, is it in Lynn County or somewhere? It's United Way, because I shared it with our local United Way. It's an app. It's their 211, but it was a simplified app, and it was really focused on those social determinants. Super user-friendly and simple, meeting health literacy needs, so having those infographics associated with a resource. It was pretty slick, but I can't remember for the life of me.
It might be Lynn County. I know that the United Way of East Central Iowa just redid their 211 app, and that very possibly is what you saw.
Okay, I think it was.
Yeah. So up on the screen, you guys have a couple of visuals. So these are the national strategies to kind of get your brain thinking about what we're talking about when we talk about best practices. So Healthy People 2020, you all have heard of before, I am guessing. And then the other one that I shared is the National Prevention Strategy. They have a very simple 2-page PDF document that helps share some of the best practices or evidence-based practices around mental and emotional well-being. So if you need ideas for best practices to implement in your community, there's a couple of resources. I know there are also other federal resources. SAMHSA has some. I'm sure CDC has some, And at the state level, we have, you know, kind of guidance documents as well. I know that, for example, related to suicide, there's a suicide plan, or there was up through 2018. I'm not sure if that's being renewed or not, or updated, I guess I should say. But any other, you know, things that are really working well for your community that you want to share?
Do any of the team members on the phone have crisis stabilization units that are in their communities that are accessed instead of ERs or emergency departments?
We have Christy, we have mental health professionals who are on call, and then they have an emergency appointment. So if we have folks who go to the ER, typically what we can do is if it's an emergency, we have slots held at our mental health facility that will allow them to get in same day for treatment, and then also do some follow-ups, you know, to try to get them immediate access to care.
Lane County is working on a new access center, which would be largely for mental health needs, and the opening date of it is not quite clear because they're actually using our public health building. They're going to renovate it and turn it into the access center, but it would be sometime after, I would say, the end of this year, or maybe early to mid, well, probably not the end of this year, but sometime in 2020, I would say, if I had to make a guess of when the Access Center would open. And the concept around the Access Center, and I know multiple communities are working on this, so maybe someone else knows more than I know, but it would just be kind of a resource center for people to receive information, maybe to receive services, where, you know, people come to the Access Center to provide services instead of making the people go to their individual agencies. And there's also going to be some component, I'm not quite sure how it would work, but some component for like a sobering unit of some sort. And I don't know what that would look like or how many beds that would be or anything like that, but that's something that they're actively working on. The other thing I know about, and I know that the Midwest Public Health Training Center is also kind of exploring this a little bit and sharing our crisis intervention teams that are law enforcement paired up with a mental health professional that can respond to like calls to law enforcement for mental health related calls. Are other communities have either one of those things?
Yeah, this is Polk County, and Polk County does have a mobile crisis unit. It's not 24 hours a day, but it's up to, I think maybe 20 hours a day, something like that, staffed by psychiatric professionals who team with law enforcement to go to those situations where there's very likely a mental illness, mental health issue. Also, Polk County has a crisis observation unit where people can, it's really for stabilization, or people just need a place to check in, built largely to avoid unnecessary ER visits, but they can go, and there are psychiatric professionals who are there to make sure that things don't get worse. Another non-medical thing that I would mention that's going on in Polk County right now, the NAMI Greater Des Moines has been sponsoring a series of community conversations that have been very well attended. They've wisely provided meals with those, and have, I think, there have been 2 so far, and I think that there might be 2 additional ones scheduled on about an every other month basis, but they're using those to build community support among providers, social service agencies, and so on, for a number of the priorities, including legislative ones. But there's been a lot of activity and discussion around the emerging children's mental health system at those meetings. But they're about a 2-hour meeting with presentations, discussions, activities at tables, and so on.
and this is Helen from Polk County. There's also an initiative underway to build a website, a database for data-driven justice so that we can connect people, again, get them to the Crisis Observation Center and then connect them to supportive services if they're not already in those. They'll be utilized by healthcare providers, by the health systems, by Polk County Health Services, and by law enforcement. And then there's some significant energy underway right now in Polk County to build a sobering center with some wraparound services for people.
This is Delma in Delaware County. So Delaware County Public Health is a hospital-based public health, and our hospital is a critical access. So we're very small. We do not have any beds within our county. But as far as the crisis stabilization beds, we do utilize them in our region, and I know that that's been a very positive thing to be able to use in the emergency department. A couple of things that we have done as a hospital is we now in the emergency have created a safe room. And the other thing, we have purchased a secure car. Our small county, in utilizing law enforcement to transfer patients, became a burden to law enforcement. So the hospital now, as I said, we purchased a secure car. It was a law enforcement car that we are able to now transport ourselves in that vehicle versus an ambulance. So those are a couple of things that, not on the prevention side, but in helping get people where they need to go, has been helpful for us.
This is Jodine in Warren County, and our the mental health region, the Central Iowa Community Services for Boone, Jasper, Madison, Powers, Sheik, and Warren counties about a year ago set up a mobile crisis team that responds. They can respond to schools. They respond a lot to law enforcement calls, so they don't have to always transport to the ED. They just provide a level of support for professionals working in the community that they've never had before. And it's been hugely successful from my point of view and is utilized often. It's staffed by mental health professionals through a facility they contract with. And it's just been really good, highly utilized in all 5 counties. So it's been a great thing for us.
Our region has that too, and that's been very helpful.
If there is not anyone else that wants to share a best practice in their community, I'd like to ask the group about how we might reproduce some of these successes. So last call for sharing of the best practices. Otherwise, I'd like to transition us to the conversation about how do we reproduce these wonderful things that are happening in our communities and other communities to make that impact greater.
This is Christy from Trinity Muscatine Public Health, and I would like to share another best practice that we've been in partnership with the last 2.5 years is, and I heard somebody say navigator, we have resource navigators. Our school district came to us and said, would you submit a proposal to us? They really have mental health, have identified it as a need, and are prioritizing their at-risk dollars to meet those needs. So we have basically 3 resource navigators in our Muscatine Community School District. We have another school district in our county looking at the model. Each one of these individuals have a background in human services, and they do all of, as most care coordinators do, they collect and connect the dots for families. There's a specific workflow in how referrals come to the resource navigators. The school have identified the tier 3, or the children with the highest number of issues related to mental behavioral health and attendance. So they're at-risk identified youth that get sent to our resource navigator either by the counselor, a nurse, or an administrator. not everybody or anybody can just send referrals their way. And they really help those families, the whole family unit, not just the child in the school. And it has proven to be quite successful. I'd love to see that model infused throughout our state and looked at as a best practice at some point with some research behind it. But it's really quite effective, and the schools paying for it with their modified allowable growth funds, or we know as at-risk dollars. And so we have that partnership in a couple different places in our community. Another one is at a local homeless shelter here in Muscatine, where we have a nurse and a social worker present. Same kind of model. And they work in the field. They don't work in our office.
Did you say that was Warren County?
Muscatine County.
Muscatine County, I'm sorry.
Hi, this is Deanne Decker. I was just going to do a quick update about a statewide platform we have that might be useful too. I don't know if this is the time you would like me to update that, or would you like me to wait a little bit?
I think it's appropriate for us when we're talking about best practices.
Okay. Well, I wanted to make sure everyone was aware of the yourlifeiowa.org website and crisis hotline that we have. In 2017, the Department of Public Health, within my bureau, the Bureau of Substance Abuse, we integrated a few websites, hotlines, and into one hub, which is used for free and confidential help, information for alcohol, drugs, gambling, and suicide, and it has lots of resources on there. And it's also a mobile-friendly, internet-based communication with also texting, and social media is on there too. I just wanted to make sure you were aware of it, such as like 1-800-BETS-OFF. Most people, my family wants to know what I do, and if I say 1-800-BETS-OFF, it kind of seems like that's what everybody has an awareness about. But we integrated this into one platform so that we could streamline our substance abuse work at that time, and with suicide being part of it too. So if you go to our website right now, there are 4 boxes that you can choose on there for alcohol, drugs, gambling, and suicide. And we had an RFP, a request for proposal, go out in 2017, and Foundation 2 was awarded the award for this project. A 5-year project, or maybe it's a 6-year, I'm not sure. But one of the things with the legislation in 2018, last year, the complex service needs legislation directed both departments here at the Department of Public Health, and then also with DHS, to have one single statewide crisis hotline through the expansion of Your Life Iowa. So hopefully around July 1, we will have a 5th box on our website, which will be called mental health. And so that if people are needing services for either substance abuse or mental health, they can go there and they can have one place to call, and one place to have a website and a chat or texting place to go to for that resource. So I wanted to make sure, and I can send information if that's more useful, but we've been in communications with DHS a lot the last 6 months, just trying to talk about the transition, because I know a lot of the regions have their own crisis lines, and how we're going to move this slowly over to Foundation 2, or if there's other arrangements made with DHS. We wanted to make sure that you were aware of that today, so that we're going to do like a soft start going on July 1. I'm not sure how much will be available then, but hopefully by October 1 for sure we'll be able to have a lot of that information available on the website and at Foundation 2 for the calls that come in. One of the things, what else was I going to say? Oh, one of the biggest things, and because you talk about the resources and linkages and things like that, and at the state level, we hear a lot about that, believe me. So I want to make sure that you're aware that on this website currently, we don't have the mental health information on there as of yet, but we have a facility locator on there. It's not perfect, but we're working on it daily, trying to improve how to locate the services that you need in your communities. And so there is a facility locator on there that you can go to your community, click on the buttons, and find services that are available in your area. And so we will hopefully in the next year be moving all of the mental health facility information onto that site also. There was legislation that was just passed in my bureau. We will receive about $306,000 for the children's piece for adding that platform to Foundation 2 to have the capacity and access for staff answering calls for children's services. Also, with DHS, we're getting an MOU together to add the adult services here soon too, adding some funding to that to add that too. So there's also going to be a warm line service hopefully, so that we don't just have a call to Foundation 2 and then the call drops after that. The person is actually connected to the treatment center. For us, it'd be a substance abuse treatment center. And for mental health, it would be eventually getting them hooked up directly before they hang up, that they have a triage to that center or have a peer support available by the end of the phone call. So I just wanted you to know that that's available coming up. It's there now for the 4 boxes: alcohol, drugs, gambling, and suicide. And hopefully in the next month or two, we'll be having mental health included on there also.
Great, thank you. That's really great information. A lot of things happening, which is wonderful. I do have a question related to that, and maybe maybe others have this question too. Of, you mentioned you were working with the Department of Human Services. So, should we be expecting the mental health regions to be sharing information about the mental health portion coming to Your Life Iowa, or how might that happen?
That is kind of a touchy subject right now. I think that they're just starting to communicate a lot of, it's not with us. It's more DHS is recently getting more information out to the regions. And I so understand so many of them have been very tied to their own crisis lines. So you can imagine the stress that puts on them to either move or mobilize that line either somewhere else, or try to make a plan with DHS to figure out how to make that a streamlined, integrated, one place to go system. And so this is just started. Communications are just starting to go out to the regions now. So I would assume in the next 6 months, there's going to be a lot of movement on this and a lot of questions coming up. But I wanted you to at least be aware from the legislation side of it, we're directed to have this one, provide that single statewide crisis line. And so DHS in the meantime has a lot of work to do, as they're the mental health authority. They're really charged with getting that mental health piece into that streamlined single statewide hotline. And so we're already there, and our provider network seems to be really aware of that system. Well, we're getting there, getting better all the time. But yeah, I'm hoping, as time goes on, it will be a much smoother, and the awareness will be out there too. So give us a little bit of time, and hopefully it'll be a smooth sailing process.
Great.
And we have, if people, I just wanted to put another plug. We have tons and tons of resources. We have posters, brochures, pamphlets, business cards with Your Life Iowa on it that some people are handing out in the hospital ERs. They're handing them this postcard, which has been really one of our biggest sellers for people wanting a product. They're handing these out in places like you were talking about. Everywhere you go, in some of our treatment centers, they're handing these out to get the resources out there so people know what number to call and the name of the website too. So if anybody needs those resources, please let me know.
Okay, we can maybe collect your contact information and share it out with the recording. Could we do that, Lori? Or Hannah? Yep. So we have about just under 10 minutes left to finish up our call, and I think that it's important for us to talk about next steps, because I'm seeing some, or hearing some kind of things bubble up that might be opportunities. So I want to skip over the reproducing successes quickly so we have a chance to talk about the next steps, because I think that's something that maybe we could talk about in the future, is how we reproduce some of these successes. So initially, the very small group of people that just started this conversation We are not the experts by any means in all of the resources available and things like that. We just know that we want to help move forward in helping our communities address mental health. And so we thought, you know, maybe a learning community is something that would be appropriate. Maybe there are other existing groups that are already meeting and already talking about this, about how to share and collaborate across jurisdictional boundaries. You know, is there a statewide group? Are there opportunities to promote working with the regions, because they're, you know, another formalized entity. So just all kinds of opportunities that exist out there. But really, I think maybe it would be great if we could get one or two next steps to move forward for how to continue this conversation. Does anyone have any ideas they'd like to share or preferences? Or I guess I should ask this question: would a learning community be beneficial, or do you all feel equipped with the information that's available to you, or do you feel like you need opportunities to learn what other people are doing and share resources and collaborate, etc.?
This is Christy Roby Williams, and I would, from Trinity Muscatine Public Health, I would love to be a part of a learning community across the state and learn some of those best practices and what's working in all the different areas.
Others with similar sentiments or arguments as to why maybe we don't need that? Does anyone know of existing communities that are currently formed that are similar to this? Sounds like maybe not. Well, I think maybe what we could do is, if there are at least you know, a handful or a majority, hopefully that we can get enough people to participate to make it really robust and beneficial to those, to really kind of share the resources and best practices and needs like we were sharing earlier. That might be something that we could try. And after a short period of time, evaluate it and see how it's working for us.
That sounds like a good plan, Caitlin.
Okay. Good. And I'm not doing a wonderful job of paying attention to the comments, but thank you to everyone who has been sharing the great information in the comments. So if you are paying attention to that, please out. And yeah, so please check that out. And then, you know, maybe instead of a learning community, or in addition to a learning community, if there are only a small group of people that have capacity to talk about this right now or think about this right now, in addition to all the other numerous things that you do, maybe we could just solicit volunteers to be part of that group to try it out and give a recommendation of if it's useful or not. Does anyone have thoughts about that? Or do you want to just open it up?
I like that idea, Caitlin. With so many things and very few resources, it would be nice to be able to sit in and hear what others have already discussed and learned and share it with us.
Okay.
With Delaware County.
Caitlin, this is Lori and Hannah. We're trying to figure out too how we can stay connected to everybody that's been on the call today. What information we can get off of Zoom, because we don't, if you guys want to continue to participate, we want to make sure that we have everybody's emails so that we can send information out to. So we can let you know in just a second how we can we collect emails?
Hey, Lori, this is Joy. If everyone chatted you, wouldn't we be able to capture the chat?
Yeah,
yes, I think that's going to be the best way to do it. I just confirmed that because we didn't have registration, there's no way for me to see who joined.
Yeah, so if everybody can put their emails in the chat box, then we can capture that off of Zoom. Thank you, Joy.
Okay, so if we put our email in the chat box, then we can send out further communication about maybe having a group of volunteers be part of a small learning community, trying that for a little while, and then sharing out the results with a larger group. Is that the direction that I'm hearing people are interested in going? Anyone?
I'm hearing Caitlin.
Are we still, can you still hear us, Caitlin?
Yeah, I can hear Danielle and Joy.
Oh, okay. I was like, I feel like a lot of people just, I don't know if people just jumped off or if we got muted. But yeah, I would agree with everything you just said.
Okay, so let's do that. And then maybe if there are ideas between now and then, we can just share amongst the group of some of the ideas. But for the tentative plan is to send your email in the chat box so the wonderful people at the University of Iowa can collect that and send out some next steps, which include a pilot learning community with sharing to the larger group. So I think that puts us at about time. I have 12:58. Is there anything that anyone would like to share before we end the conversation? Okay, y'all are ready to go. Our hour is up, huh? Well, thank you all for joining and sharing all this wonderful things, these wonderful things that your communities are doing. I know for me, it's prompted a lot of ideas that I have that I want to take back and talk to other people in my community about. So I hope that's the case for all of you. And this was recorded, so we will also be able to share out the recording as well. So Lori or Hannah, anything you guys want to say, or Joy or Danielle, before we close?
I just want to say thank you for everybody for coming on this call, because, you know, we knew, I'll just be honest, when mental health was chosen in my community, I was nervous because it was so outside of my wheelhouse and area of expertise. But as we saw it become a priority across the state, I'm just so glad that we're coming together to try to move the needle forward, because we are still all struggling with the same issue. And just considering the conversations that have been had around children's mental health and what they're looking at doing in the regions, I'm just really glad that you are all here to have these conversations to see if we can help each other move on this issue that is outside of our wheelhouse a bit.
And this is Joy, and I'm also grateful for all of your participation. And we will, I'll make sure, I saw a couple chats about the cards for Your Life Iowa, and I will make sure that you guys get that information through Lori or some other venue. So I'm on it.
Okay, we'll stay connected to everybody. We've got emails coming in, so thank you so much. And Caitlin, Joy, and Danielle, I think this is coming together. Thank you for leading today, Caitlin. Appreciate it.
Yes, thank you all, and have a wonderful week.
You too. Thank you.
Thank you.
Thanks. Bye-bye.
Huh. What's the problem? I can't get this thing to